Good evening. Tonight, we bring you a special report, The Silent Truth, COVID-19 Unmasked. When the virus first hit, we were told that things are under control. But what if the truth was darker than the headlines? What if behind the carefully crafted statements are actually the lives of real people drowning in silence? This is not just a story about a pandemic. It's a story about truth, power, and the fight to be heard.
Ladies and gentlemen, good afternoon. So we understand the public's concern, and let me begin by saying this clearly. Our healthcare system is fully equipped to handle the current situation. Okay. So hospitals across the nations are operating within safe capacity, and our medical personnel are mobilized, and also supplies are sufficient. Our numbers are accurate, verified, and updated daily. We are working closely with the international health bodies to monitor and respond towards this issue. And we will make sure that this situation will remain stable. And so from this, we urge all citizens to not panic. Avoid spreading unverified information. Instead, follow updates only from the official government platforms. Together with calm and cooperation, we can weather this challenge. Trust the process, stay safe, and thank you.
By week 3, we were overwhelmed. No more beds. We placed patients on plastic chairs. Some lay on the floor, gasping for air. PPE we used for days. Oxygen tanks shared between 2, sometimes 3 people. But still, we were told, don't talk to the media. Keep it internal. They won't let us speak. I couldn't do it. I couldn't keep quiet while people died. Why families begged for updates. And we just got silent. So I leaked the truth, photos, messages, the numbers they tried to hide anonymously, not for fame, not for revenge, but for the people we lost and the ones we were trying to save. Someone had to speak, even if it meant breaking ranks.
My son had a fever, so we rushed him to the hospital, but they say there was no bed left, and they turned us away. And that is how he died in our car, right outside the hospital gate. But then the media are spreading lies without fact-checking, without knowing the truth, and it hurt my whole family. It is not the truth. I begged for answer. I went to the media. I went to almost everything I can do, but no one listened. So I posted my story on Facebook. Within 12 hours, it went viral. That is how people start paying attention to the truth. That is when the truth starts spreading about my son's death.
People keep saying online learning was the solution, but for me, it felt like being left behind. You ever stare at your screen for 10 minutes, waiting for your class to come back on? This one shares 2 younger siblings. We had to take turns for school. There were days I had to choose to buy top-up or dinner. I watched my friends slowly disappear. First, they stopped replying. Now, they stopped coming to class. No one asked where they went. Not the teacher, not the system. I checked the portal. My name was absent for the whole week. Not one call, not one email. The silence. I was here. I was trying.
Sarah never came back after MCO. Uwais dropped out in 2021. They don't have stage 4 listening because no one counted them.
We are not ready. We didn't give up. We are surviving. You just don't see us because we weren't looking. We are still here, even if you refuse to count us.
You know what they told me when I tried to report what was really happening? They said, Maria, this is the time for drama. Just stick to the official numbers. When I looked them dead in the eyes and said, people are dying in the hallways. Nurses are collapsing on their feet, and you want me to write about case numbers? They said I was being emotional. Of course I was emotional. How could I not be? Every day I got texts from doctors saying, we're running out of beds. Our friends crying because they couldn't even say goodbye to their parents. But apparently that wasn't newsworthy enough, so I quit. Just like that. I walked out and I told myself, if they won't let me tell the truth, I will do it by my own way. One nurse told me, we have stopped treating everyone. Now we choose who get to live and who doesn't. That hit me hard. So I told the stories. I recorded, uploaded and shared them. And slowly people started watching. One comment said, that's when I knew we weren't alone. We just needed someone to say it first, to be brave enough to speak. I didn't become a reporter to make headlines. I became one to speak for those who couldn't. And in the time when silence felt safe, I chose to be loud.
The news said my stall caused a COVID-19 cluster. One reporter came, just one, took a photo, did not speak to me, did not ask a single question. Next thing I know, there is an article online. My stall blurred, but everyone knew it was mine. They wrote, sources confirm.
What sources? I was not even sick.
In just 2 days, I lost everything. No customers, no calls, just silence. Like I had a disease. But a few days later, the health department released a statement. It was not my stall. Someone else, somewhere else.
You think the media corrected it? Cleared my name? No, they just moved on. Like my business, my reputation were not even worth a follow-up.
I had to print flyers, walk around, hand them out, explain myself like it is 1990, beg people to believe me.
Accuracy is not just about facts. It is about what those facts do to real people, to small businesses, to trust.
To a woman who did everything right and still lost.
I delivered food to many luxury condos and houses, while my kids shared one bowl of rice at home. Looking at the differences made me realize how cruel we're being treated. I always dread when it's time to cook for my whole family because there's never enough rice for all of us. No aid came, just empty promises were spoken as usual. One day, I decided that it was time to speak my truth. At that time, it felt like our voices were not heard at all. My last resort was to publish a post in hope to capture people's attention on the reality of our citizen state. In the post, I spoke about my experiences for these past few months and took a picture of my barely stocked fridge as a way to prove my struggle. Surprisingly enough, it blew up. It started with one person asking for my QR code and bank account, to me receiving a large amount of donation in just 2 days.
I can't believe that people are kind enough to help us when I have tried endlessly to speak up, but never once heard from the people in charge.
The rakyat saved me, not the system.
When the system failed us, we didn't wait, we act. As an NGO co-founder, I saw firsthand how ordinary people step up in extraordinary ways. We built our own data dashboards when official numbers stopped making sense. We opened food banks, distributed essentials, ran mental health helplines, all with zero government support. Because if we waited for a rescue, we wouldn't have made it. There was no blueprint, just urgency. Students coded tracking sites from their dorms, mothers shared whatever rice they had left, volunteers like teenagers, retirees, everyone, messaged strangers, us who needed help, and somehow it worked. This was never just about battling a virus. It became about reclaiming the narrative they tried to control. While they silenced the truth, we made it louder. And our voices, they were not polished speeches. They were raw, real, echoing from food queues, online fundraisers, and late-night Zoom calls where we planned our next steps. We were not in positions of power, but we held something greater, purpose. We were not experts, we were survivors. We didn't ask for permission to care, we just did it. So, if anyone ever wonders what the rakyat did during the darkest days, tell them we didn't wait to be saved. We saved each other. We built what they failed to. And through it all, we brought each other back to life.
The officials and higher-ups told one story, but the people told another. This was a pandemic of truth versus control. And in the end, it was the truth that fought back. Let history remember not what was said on paper, but what the people had been through. This has been The Silent Truth COVID-19 Unmasked. Thank you for watching. When headlines were scripted and questions silenced, the people turned to each other. The lesson? Truth survives when we speak, share, and question. Control can hide facts, but never erase them. Stay curious, speak up, protect your voice.
The government should tell us the truth, not just make things sound better than they are. People need real information, not stories that hide the problems. If you don't know what's really going on, how can we fix anything? Being honest might be hard, but it shows respect. We deserve leaders who are clear, not ones who try to make everything look perfect when it is not.
Hello, so I play as a doctor in the scene. What I can say is that when the mask broke down, so did the silence. This scene isn't just about missing PPE, it's about the power of truth. One doctor chose to speak up when others couldn't, not for the headlines, but for the humanity. Because sometimes, telling the truth is the most life-saving act of all.
The truth is not always loud. It doesn't always trend. But it matters because behind every headline there's a real human being. One silent report can create fear, spread lies, and hurt the innocent. So, whether you are telling a story or sharing one, check the facts. Speak with care. Truth is not a choice, it's a duty.
The role of media is not just to inform, it is to tell the truth. Silence, selective coverage, and half-told fact destroy public trust. When the media choose to distort the truth, the public will lose faith in them. Truth is not always easy, it's not always popular, but it is necessary. In a world flooded with information, real journalism must rise, clear, honest, and brave. The truth matters, tell it to the public.
Hi, I'm Maria, and from my segment 5, I learned that truth matters even when it's uncomfortable. When the system asked me to be silent, I knew that silence would only benefit the powerful, not the people. So I choose to speak up, not for the sake of making headlines, but for the nurses, doctors, and families who were suffering in silence. The most important lesson, even with just my phone and my voice, I discovered that being bold enough to share the truth can result in real change. Thank you!
When it comes to news, Truth should always come first, especially when small businesses are involved. One wrong headline, one unconfirmed story can ruin someone's only source of income. No trust, no customers, and rarely a second chance. That's why media should be responsible. Don't just post, ask questions, confirm facts. Talk to people before reporting. Because behind every small business is a real person doing their best to survive. Truthfulness in reporting is not just about getting facts right, it is about protecting real lives and real livelihood.
When the government's help is slow or missing, everyday people can still change lives. By caring, sharing, and standing together, people can fill the empty spaces and give safety to those who are in need. Our kindness should never stop at one viral post. We must keep working hard together so that no one has to bet online for them to be seen and helped. Therefore, kita jaga kita.
In times of crisis, when institutions are overwhelmed or unresponsive, NGOs and everyday people play a vital role. NGOs should focus on rapid, community-based responses like setting up food banks, mental health helplines, or digital tools. Meanwhile, ordinary citizens can support by volunteering, donating, or sharing accurate information. These grassroots efforts create safety nets that formal systems sometimes miss. Together, they show that collective action, even without official power, can lead to real change.